Can tinnitus be cured? Many ask, can tinnitus be cured? Is there cure for tinnitus? How can I stop the constant ringing in my ears? Unfortunately, tinnitus is not curable. So far, there is no scientifically proven cure or documented treatment for tinnitus. But most people can learn to live and cope with their tinnitus. In this article, you can read more about how to deal with tinnitus and what options you may have. The bothersome and uncomfortable noise in your ears varies from one tinnitus sufferer to another. So does the impact of tinnitus on people's lives. Some get used to the noises in their ears with relative ease, while others are struggling with their tinnitus. Some may even experience anxiety or depression. Therefore, many ask, can tinnitus be cured? Is there a tinnitus cure or a tinnitus treatment or tinnitus remedy? How do I get rid of my tinnitus? Is there a cure for tinnitus? But is tinnitus curable? On the internet, on TV and radio commercials and in papers and magazines, you can easily find many who say tinnitus is curable and offer a method that can cure, or at least reduce, tinnitus. This could for example be in the form of medication, pills and injections, herbal treatments for tinnitus, or natural cures. Different types of therapy and hypnosis are also offered. But other cures also exist. The list of cures is long and is constantly getting longer. Luckily, many can live with their tinnitus as it may only occur occasionally and/or is relatively quiet. But for some, the tinnitus is so bothersome, severe and intense that it negatively influences their daily lives and quality of life to a very large extent. For those people, it is very natural to look for a cure that can make the tinnitus go away, or at least reduce it. But unfortunately, there is as yet no scientifically proven cure or treatment for tinnitus. So far, no scientific study on tinnitus or research into tinnitus has documented or proven any tinnitus cure. Therapies and counseling against tinnitus. Some who suffer from tinnitus may find help in different forms of therapies and counseling with different types of tinnitus coping strategies, for example a therapy called tinnitus retraining therapy or TRT. Psychology plays a large role in tinnitus and some tinnitus sufferers may benefit from these types of tinnitus-related offers. These may help you learn how to live with tinnitus. Tinnitus masker. For some who suffer from tinnitus, a so-called tinnitus masker can be helpful. This masking device is an electronic instrument that generates and emits broadband or narrowband noise at low levels, designed to mask the presence of tinnitus. Read more about a tinnitus masker. A good idea could also be to contact the National Tinnitus Organization or Organization for the Hard of Hearing and in this way, get in contact with others who also struggle with their tinnitus. Experiences from others who live with tinnitus may often be very helpful. Get your hearing checked. If you experience tinnitus, you might also have a hearing loss. So, if you have tinnitus, we recommend that you get your hearing checked by a hearing professional. Tinnitus and hearing loss. Medical research in the past few years has shown that those who have tinnitus also have some form of hearing loss. For some, this hearing loss can be so small or only affect a narrow band of frequencies. So it does not result in hearing loss apart from the tinnitus experienced, but for others, the hearing loss may be larger and affect more frequencies. If the hearing loss is so large that the hearing loss can and may be treated with hearing aids may then help reduce the experienced tinnitus. Hearing aids can help with tinnitus. Scientific, medical and audiological studies have shown that hearing loss can be treated with hearing aids and with this the increase in audiological input can reduce tinnitus or at least the tinnitus experienced. Therefore, if you experience tinnitus, it may be a good idea to have a hearing test to see if the tinnitus is accompanied by a hearing loss that could be treated with modern hearing aids. But it is also important to stress that others who experience tinnitus may not have a hearing loss to an extent that it needs to be treated. How to cope with tinnitus. How to live with tinnitus. The answer to this question is very individual. Each person with tinnitus must find his or her way to cope with the tinnitus. But in general, it is a good idea to avoid stress and get rest. It may also be a good idea to avoid noisy situations and loud music. Some may benefit from relaxation exercises. Many experience that their tinnitus increases or gets worse by drinking coffee or alcohol or by smoking. Therapies and coping strategies may ease the tinnitus for some. Sound therapy may also help. For others, alternative therapies such as acupuncture, chiropractic and hypnosis may ease the effects of tinnitus. But it is important to stress that the effects of these alternative therapies are not scientifically documented. How to stop tinnitus getting worse? Can I stop my tinnitus from getting worse? This is also a very good question. But again, the question is difficult to answer. But you can do several things to reduce the risk of the tinnitus getting worse. Some general advice is, avoid noise exposure and loud music, avoid stress, try to get rest and a good sleep. For some it also helps to avoid alcohol. Coffee and tobacco. Can tinnitus be cured naturally? Many ask for or search for a natural cure for tinnitus. But just as there is no medical cure for tinnitus, there is also no scientifically proven and tested natural cure for tinnitus. Why is there no cure for tinnitus? Tinnitus is still a bit of a mystery to doctors and scientists. There is still a lot of uncertainty over what tinnitus actually is, how tinnitus develops and where tinnitus is located. Because of these uncertainties, it is also very difficult to find or develop a cure for tinnitus. Will there ever be a cure for tinnitus? It is difficult to predict what will happen in the future. The answer to this question is therefore maybe. Scientific knowledge of tinnitus has increased a lot in the recent years. So maybe one day someone will find a treatment that can reduce or completely cure, remove, tinnitus, different types of tinnitus, ringing in your ears. Hissing, buzzing, roaring, tinnitus can take many forms. Some people may experience a thumping or whooshing sound in their ears with the same rhythm as their heartbeat. This is called pulsatile tinnitus. What should I do if I have tinnitus? If you experience tinnitus and the tinnitus affects your daily life, you should contact your doctor to discuss what might help you on how to deal with tinnitus.